You're watching EAC News. Thanks for joining us. The World Health Organization's top Europe officials has announced on Tuesday that more than half of the European population are expected to be infected with the Covid-19 Omicron variant within the next 6 to 8 weeks.
World Health Organization's Regional Director for Europe, Hans Kluge, has announced that a new west-to-east tidal wave of Omicron infections is sweeping across the region on top of Delta infections. He stated during a news briefing that Europe saw more than 7 million newly reported COVID-19 cases in the first week of 2022, more than doubling over a 2-week period. The Institute for Health Metrics and Evaluation forecasts that more than 50% of the population in the region will be infected with Omicron in the next 6 to 8 weeks.
50 of the 53 countries in Europe and Central Asia have now reported cases of Omicron. It is quickly becoming the dominant virus in Western Europe and is now spreading into the Balkans. At this rate, the Institute for Health Metrics and Evaluation forecasts that more than 50% of the population in the region will be infected with Omicron in the next 6 to 8 weeks. The Omicron variant represents a new west-to-east tidal wave sweeping across the region on top of the Delta surge that all countries were managing until late 2021. How each country now responds must be informed by its epidemiological situation, available resources, vaccination uptake status, and socio-economic context. The region saw over 7 million newly reported cases of COVID-19 in the first week of 2022, more than doubling over a 2-week period. Data collated in recent weeks confirms that Omicron is highly transmissible because the mutations it has enabled it to adhere to human cells more easily. And it can infect even those who have been previously infected or vaccinated. Allow me to reiterate that the currently approved vaccines do continue to provide good protection against severe disease and death, including for Omicron. But because of the unprecedented scale of transmission, we are now seeing rising COVID-19 hospitalizations. It is challenging health systems and service delivery in many countries where Omicron has spread at speed and threatens to overwhelm in many more.
The World Health classifies the overall risk of Omicron to be very high, noting in a recent technical report that it has a significant growth advantage over Delta, leading to rapid spread in the community. The organization has said that the rapid increase in cases will lead to an increase in hospitalizations, may pose overwhelming demands on healthcare systems, and also lead to significant morbidity, particularly in vulnerable populations. Another World Health Organization official, Catherine Smallwood, warned that COVID-19 is still a way off from becoming an endemic. She defined an endemic as a stable circulation of the virus at predictable levels and potentially known and predictable waves of epidemic transmission. She further added that what we're seeing at the moment coming into 2022 is nowhere near that. And we still have a huge amount of uncertainty. We still have a virus that's evolving quite quickly and posing new challenges. So we're certainly not at the point of being able to call it an endemic.